Hello everyone. This is Abdulmajeed Alshehri. I am an assistant professor of pharmacy practice at King Saud bin Abdulaziz University for Health Sciences. And today I will be presenting on effective manuscript review, a guide to providing insightful and constructive feedback as part of the research loading dose initiative by the Escape platform. And before I get started, I would like to thank the Escape team for the invitations to present on this topic. The objectives of today's presentation is to understand the core principles of high quality manuscript review and to recognize common pitfalls in peer review and also to develop um skills for providing constructive feedback. The outlines today will be to go over the some of the important aspects of this presentation, which is the goals of high quality manuscript review, criteria for high quality review, characteristics of an effective reviewer, expectations in peer review, systematic approach for review of a manuscript, how to structure your review report, and skills for providing constructive feedback. The main purpose of peer review is to offer insightful and helpful critiques that enhance the quality of the work. Providing a constructive feedback is essential to a successful peer review process, and by following a systematic approach to peer reviewing, this will ensure a helpful experience for all the authors, the reviewers, and also how the review is conducted directly influence the author's ability to improve and refine their manuscript. So why peer review? Peer review is very important in the research. A well executed peer review raises the scientific standards of the field. It enhances the reviewer's ability to critically assess the scientific research and methodology. It also opens the opportunity to generate new research ideas, and also it opens opportunities to write editorial and commentaries. The main goals of a high quality review is first, scientific validity. The big question that we are trying to answer here is the research accurate and reliable? Does the work presents new or novel insights? And also, is the research significant and impactful? Other goals of high quality review is to identify and addressing any error in analysis, details, or misinterpretations, and also to assist author in enhancing the clarity and quality of their manuscript. There are many challenges of high quality review. Number one is the lack of transparency in data sources, making it difficult to assess the credibility of the presented data. Also, sometimes there is some pressure for immediate results driven by the culture of urgency within the critical care field. Also, inability to independently verify data quality and integrity, and or exaggerating the study's importance, resulting in inflated claims about its impact. Another a big challenge to high quality review is predatory journals, which doesn't require a high quality review, which compromise the process of peer reviewing. A high quality peer review focuses on three fundamental questions, as I mentioned earlier, which is the research accurate? Is it original? And is it meaningful? While most journals share a similar editorial structure, review process, the specific elements and timelines can vary between journals. Several factors can compromise the integrity of peer reviewing process, which we have to be mindful of. And also, reviewers should familiarize themselves with the journal's review policies before agreeing to participate in the manuscript review. What are the characteristics of an effective reviewer? An effective reviewer has the ability to deliver feedback in a timely manner, has the ability to conduct ethical review and be unbiased, and also be able to provide a constructive feedback, and has some experience in the subject matter of the manuscript, aware of the journal review guidelines, and show some respect to the authors, to the editors, and also colleagues, and also has the ability to identify grammatical errors. So, what are the expectations in peer review? When you are assigned to review a manuscript, what are the expectations that you should follow? There are some expectations from the editors if you are reviewing for a journal, and there are also some expectations from the authors. So, what editors need? They need a concise evaluation of the scientific merit of the research, its contribution to the field, its relevance to the journal target audience. On the other side, authors need clear and practical feedback on the quality and appropriateness of the work for publication, specific issues that can be resolved to enhance manuscript. Also, authors need unidentified gaps that need to be addressed, and a well-reasoned, respectful suggestion supported by references for any recommended revisions. Now we'll discuss the systematic approach for review of a manuscript. Before accepting a review invitations, you have to perform a self-assessment, and that's being done by asking yourself 3 questions. The first question is, do I have any conflict of interest? Am I qualified to evaluate this manuscript? And the third question is, can I complete the review within the required time frame? If you answer no, or if you answer yes to any of these questions, then you should be able to proceed to the next step. So if you have a conflict of interest, then you have to declare it and make it clear, and also you can reject the invitation to review, and also you should be qualified enough to review the manuscript, and also you should have time to perform that. So after performing the self-assessment, you can now accept the invitation to review and move to the thorough evaluations. Usually, thorough evaluation of manuscript require multiple readings to provide valuable comments and great thoughts on the manuscript. And the first phase of doing that is to identify major flaws in the study design, and that's by identifying relevance to the journal scope, and also to identify any unethical practices or any major methodological issues that cannot be addressed. Then you can perform a high-level evaluation of the manuscript by assessing scientific merit of the uh, manuscript, its contribution to the literature, and also you can assess the appropriateness of publication in general. However, usually you can provide, a complete recommendations for publication by or after doing the section by section review, which is the last step. So what we mean by section review is to offer detailed, constructive feedback on each part of the manuscript. So the section by section review starts with the introduction. A well-written introduction usually presents central arguments, summarize recent research, highlight gaps that need to be addressed, and also conflicts in existing literature, and establish the originality of the research by showing the need for further investigation in this area, and also clearly identify the purpose of the research and emphasize the novelty and relevance of the manuscript. Then we can assess materials and methods. An academic research should be replicable, repeatable, robust, and follow the best practice. And what we mean by replicable, that repeated analysis show the same results. The research have or has followed an appropriate sampling technique. And then repeatable. What we mean by repeatable, that if other researchers are or other researchers are able to carry out the same research. And then also the research should be robust, which means robust data and reliable data. And then best practice means that the methodology of the research have followed ethical standards and also standard guidelines that or standard guidelines for any observational or randomized control trials depending on the study design. Then we can evaluate results and this discussion. Um, Usually, these sections should tell a coherent story. So, what happened, what was discovered or confirmed. Usually, you can begin by, a well-written results and discussion begin clearly by summarizing the data, okay, and also reference any statistical analysis like statistical significance, evaluate trends and explain the significance of the results. And then the discussion should bring all findings together, forming a coherent narrative, and also to address any gaps and limitations of the research that future research needs to address. For the conclusion typically consists of a few concise paragraphs, can be integrated in the results and discussion section, also should directly reflect whether the study aims were achieved, and should align with the stated aims and contain no unexpected findings. For the reviewing or the section by section review for the image and graphs and data tables, usually if the data or visuals don't clearly convey a story or don't convey an important message, then we should request improvement in presentations, whether it's titles, labels, statistical notation, or quality. We should ensure that the results are plausible and free of errors, and also verify that trends support the what's being mentioned in the paper discussion and conclusion in the text section, and also to check for potential image manipulation or edit. References, you will need to check referencing for accuracy, adequacy, and balance. And you have to ask, are the references helpful to the reader? And we have to make sure that the references, not over-reliant on self-citation. After completing the review process, you can formulate your review report. And the question here is how to structure your review report. You can start with a summary of the manuscript by providing detailed overview of the core content, purpose, and key findings of the manuscript. And then the second section is for your systematic evaluation of the manuscript components by reviewing each section and highlighting strengths and issue, and suggest also possible solutions for that issues. And the last section will be a recommendations to the editor, whether you accept or request major or minor revisions or reject. And an important thing with this section is to provide a well-reasoned explanation for your recommendations to the editor. So this is an example of the reviewer comments format. So you can start with a brief summary, provide concise overview, highlighting study aims, design key findings, also highlighting positives and negatives of the study. Usually the brief summary are 2 to 3 sentences in length. And then the second thing is the major comments. And major comments usually include any comments in this that are related to scientific merit and contribution to the field, address concerns related to the study methodology, note any absence of ethical statements or approval, highlight potential issues with plagiarisms, and point out relevant literature and topic area that hasn't been cited. Minor comments usually are minor, so they suggest improvement for clarity, correct any errors in the assignments or measurements units to the results, or note any missing minor references. And also here we have um, examples of constructive feedback. A very important piece of information that the reviewer should provide is constructive feedback. And what we mean by constructive feedback is to give the feedback itself and also solutions to improve and highlight any areas for improvement. For example, a non-constructive feedback could be the introduction part is too long and boring. However, we can make this feedback constructive by saying the introduction could be more concise by focusing on key background and information relative to the study aims. Consider removing unnecessary details or shift some of the content to the discussion section for a clearer narrative. Another example of non-constructive feedback is the figures are unclear. However, we can make it more constructive by saying the figures would be easier to interpret if the axis labels were more descriptive, and if a legends were included and to explain the different lines. Adding a unit to the x-axis or y-axis would improve the clarity for readers. In conclusion, the main goal of peer review is to raise the scientific standards of the field. A good peer review can be learned and practiced. Focus on the scientific merit of the manuscript rather than spelling, grammar, or readability. Refrain from using a negative or overly critical tone. Be mindful of keeping your review concise and to the points. Ensure feedback is constructive and helpful. And that concludes our session for today. Thank you so much for your time.